My name is Hernandez. I'm the Chief of Neurology and also Medical Director of the International Program at JohnsHopkinsAllChildren'sHospital. I'm also a Professor of Clinical Neurology at Johns Hopkins University School of Medicine. Neonatal epilepsy is one of the conditions that we see in our child neurology clinics. We see that not infrequently because of the high incidence of neonatal seizures during this early stages of child development. Neonatal seizures can be diagnosed immediately after birth. Sometimes they can be diagnosed several days to a week or two after they're born. Sometimes we have babies that the mothers feel them seizing inside of them right before they're born. Some of those conditions where the mother feels the baby seizing in utero could be devastating for the babies. Neonatal seizures can be due to multiple reasons, but the most common one is because of lack of oxygen, but we also have conditions, neonatal seizures caused by genetic problems, brain abnormalities, among many other reasons. Babies that are born in the community at other hospitals, the physicians should have high suspicion if they see abnormal movements, or the baby have been at risk for any condition, whether the babies were exposed to lack of oxygen at any time. We want them to have a high degree of suspicion. If they see a baby having abnormal movements, they should consider doing an EEG during that period of time to determine if the baby is more prone to have seizures or not. We like those babies that are diagnosed with seizures to be monitored very closely, and some of them may need to be transferred to a higher level institution like ours for continued monitoring. We also have different treatment options for patients with neonatal seizures. We are working currently in our clinic to develop a fetal neurology consultation service where mothers that are pregnant with children with neurological conditions could come and be evaluated and hopefully discuss options for their future children. In addition to that, we do have a neonatal follow-up clinic that we see patients that we have taken care of in the hospital in our neonatal intensive care unit. So most children with neonatal seizures will probably go home from the neonatal intensive care unit off anti-seizure medication. They don't need to continue medication for the rest of their lives. There are some patients that unfortunately due to their underlying reasons for their epilepsy will require to be on medication for a longer period of time, sometimes indefinitely. Well, I appreciate the time and I thank you for listening.